student family nurse practitioner. What brings you into the clinic today?
Yeah, I've just been having a lot of anxiety lately and having these flutters in my chest and just having a hard time sleeping. I feel really just tired all the time. And I just don't really know what's going on.
Okay. Yeah, that sounds like a lot is going on your plate. But before we get started, there's a couple of questions I'd like to ask you. Are you taking any medications or herbal supplements at this time?
Man, we've just been working so hard and it just is not seeming to be working.
I know, I haven't noticed any weight coming off, but I talked with my trainer about it, and he recommended Ephedra. You want to try it?
Yeah, let's do it.
Okay. I think we'll start with 4.
Okay.
I'm not sure what the recommended dose is.
It's natural, so it's safe, right?
Yeah.
Yeah.
That's good.
Yeah. Let's go work out. Let's do it.
Okay.
Ephedra for weight loss.
Did you know that Ephedra has been banned by the FDA since 2004 due to adverse side effects to include stroke, seizure, anxiety, insomnia, irritability, restlessness, dizziness, psychosis, hypertension, arrhythmias, heart attack, myocarditis, cardiomyopathy, tachycardia, nausea, vomiting, anorexia, difficulty urinating, kidney stones, myopathy, and myalgias.
Man, I had no idea. I thought it was safe. I thought herbs were natural.
Hello everybody, this is Lieutenant Daniel Coleman, and we'll be presenting Ephedra and its effect on weight loss, along with Major Aria Klein, Lieutenant Commander Megan Snyder, and Lieutenant Tuparin. So, is Ephedra appropriate for weight loss? Ephedra is derived from the ma hung plant, traditionally used in respiratory diseases such as asthma in Chinese medicine. Combined ephedra and caffeine products were promoted as a weight loss supplement during the 1990s and early 2000s. However, in 2004, ephedra was banned for over-the-counter use by the FDA. There were noted 18,000 adverse effects. Though ephedra is appropriate for the use of weight loss, we do not recommend its use due to the increased risk for cardiovascular toxicity and hepatotoxicity.
Ephedra contains ephedrine, a symphomimetic catecholamine. It is an alpha and beta adrenergic receptor agonist and an SNS stimulant. Ephedra has an indirect release of norepinephrine from sympathetic neurons. It causes smooth muscle relaxation, bronchodilation, increased cardiac output, increased peripheral resistance, vasoconstriction, pulse, and blood pressure. It is also a central nervous stimulant. The adverse side effects of ephedra are as follows. For CNS, it can cause stroke, seizure, anxiety, insomnia, irritability, restlessness, dizziness, and psychosis. For cardiovascular, it can cause hypertension, arrhythmias, heart attack, myocarditis, cardiomyopathy, and tachycardia. For GI, it can also cause nausea, vomiting, and anorexia. In genitourinary, it can cause difficulty urinating and nephrolithiasis. For musculoskeletal, it can cause myopathy or myalgias.
So using ephedra has a lot of medication and dietary interactions. When using ephedra with anticonvulsants, it's been associated with seizure activity. Concomitant use of ephedra interferes with the effectiveness of the anticonvulsant drugs. While using it with beta adrenergic agonists in large amounts, it can increase the cardiac inotropic effects of the beta agonists due to ephedra's stimulant effects. When using with dexamethasone, it increases the half-life and metabolic clearance rate of dexamethasone in asthmatic patients, which may result in lower blood levels of the corticosteroids and an increasing dose in asthmatic patients or other patients requiring the corticosteroids for immunosuppression. When using ephedra with MAOIs, it increases the risk of hypertension, hypotension, hyperpyrexia, hallucinations, convulsions, rhabdo, and urinary problems. Taking ephedra with caffeine can lead to excessive adrenergic stimulation, which increases blood pressure, heart rate, and risk of cardiac arrhythmia or stroke. The clinical trial data for ephedrine has been well documented, but not for ephedra. The data is limited due to the limited number of trials done, and the longest trial was only 6 months. The data results for short-term use showed weight loss in 4 to 6 months, body fat decreased, and when combined with caffeine and other dietary supplements, showed a modest increase in the amount of weight loss. Long-term use of ephedra has no conclusive data.
So the safety of ephedra. Ephedra can cause severe life-threatening or disabling adverse effects, as we've already previously talked about. Ephedra, therefore, has been banned in the U.S. for major sport entities such as the NCAA and the NFL. There have been several case reports that have been linked to ephedra to include these serious side effects of hypertension, heart attacks, seizures, strokes, and psychosis. So what are some of the major contraindications for using ephedra? As you can see, this is a very long list of things that are contraindicated for this herbal medication. Some of the big ones to point out are cardiovascular disease, high blood pressure, seizure disorders, suicidal tendencies with depression, and using this in conjunction with other stimulants, decongestants, diet medications, can cause a compounding effect of all of these contraindications and side effects of ephedra.
Continuing, discontinuation, or for surgery, when would you discontinue? So, the American Society of Anesthesiologists recommends that patients stop taking herbal medicines at least 2 weeks before surgery. When combined with anesthesia medicines, ephedra can cause hypertension, SNS stimulation, to include abnormal heart rhythms, cardiomyopathy, and hyperglycemia. So we would recommend that the patient discontinue this medication. So as of 2015, ephedra is classified as a Class B, not admitted into the United States Pharmacopoeia National Formulary monograph development process. We recommend to discontinue this medication due to the fact that it has life-threatening cardiac events and is associated with 18,000 adverse events and is banned in the United States.